Hello, dear doctors. I am Dr. Azhar. Today, I will tell you about rheumatoid arthritis. Before that, please subscribe my channel and view it and like it. Today, the topic is rheumatoid arthritis. How to pass in first attempt MRCGP South Asia. Please listen to me carefully and see this full video. Now, in rheumatoid arthritis, what we will discuss specific points of history. Other history, all doctors know that the routine history you will take about family history, drug history, psychosocial history, long-standing illness, and all other history you know. But today I will tell you specific points of history, red flags in rheumatoid arthritis, some about some summary, and then reassurance of the patient. This I will explain today. Now, what are the specific points of history which you will ask the patient? When he will tell you that I have pain in this joint, in one joint, he will tell you. Specific points are always ask which joint, site of pain, and is it on one side of the body or bilateral? Bilateral symmetrical joints are involved in rheumatoid arthritis. And also ask stiffness of the joint. If patient will say yes, then at what time more stiffness, in the morning or later, or in the morning there is stiffness, it will be relieved. And tenderness and swelling around the joint, or is there pain in one joint or more than one joint? These are some specific points of history which please don't forget to ask in MRCGP exams. Now, red flags. Always ask about fever, night sweats, any lumps and bumps in the body. I want to say about lymph nodes, fatigue, weight loss, and weakness in any part of the body. And other than red flags, when you will summarize the patient, patient will ask you what is rheumatoid arthritis. After summarization, you will say this is a disease which in medical terminology we say it rheumatoid arthritis. Do you know about this? You will please ask the patient, do you know about this, or you have ever heard about this disease? Then patient will say no. Then you will explain that this disease there is some inflammation or swelling inside the joints of the body bilaterally and symmetrically, and there can be stiffness of the joint, and there can be difficulty in working. This will be the explanation about rheumatoid arthritis. Then patient will ask you that what I will do with this, what is the plan, what is the management. Then you will reassure the patient that this disease is curable nowadays. We can control this disease. Don't worry about this. Treatment is long term, and there are so many number of medicine nowadays, latest medicine which can control this disease, like disease modifying drugs, monoclonal antibodies, NSAIDs, steroids, local application painkillers. This you will explain to the patient, and you will say that for the time being, I will give you some tips for home and some medicine for home. Tips at home, like please do stretching exercises, please do walk, light exercises you can do. You can give hot packs or cold packs at the site of pain, and you can take some NSAIDs like dicloran or like ibuprofen. But before prescribing this dicloran or ibuprofen, ask, do you have any allergy? Then some painkiller gels you can give for application on the site of the pain. After this, you will say to the patient that please After the confirmation of the diagnosis, I will refer you to rheumatologist. Rheumatologist, he can ask what he will do. Then you can explain the patient that rheumatologist will prescribe for you either disease modifying drugs or monoclonal antibodies or this steroids. Then he can ask how you will confirm the diagnosis. You will explain the patient that from the history you have given me, and I will offer you some lab tests. After the result of the lab test, I can confirm your diagnosis, and the lab tests which I will write for you are ESR, or rheumatoid factor, and about anti-CCP antibodies. And because you have to start disease modifying drugs, so I will do for you liver function tests also. I will give you appointment after a week. Then you will come and we will discuss the lab results, and then your diagnosis will be confirmed. And after this you can give pamphlets, and you can give advice about diet, and safety netting is very important in every case of MRCGP. Next video, inshallah, we will discuss about some other disease, and I hope you like my video.